Question 1. A pharmacy technician receives a prescription for lisinopril 10 mg POQD number 30 refills. 3. The patient picks up the medication and requests to pay cash, stating they do not have insurance. What is the most appropriate action for the technician to take regarding patient counseling? I. Inform the patient that the pharmacist will be available for counseling if they have questions. B. Counsel the patient on the importance of taking the medication daily as prescribed. C. Advise the patient about potential side effects like dizziness and cough. D. Provide the patient with a printout of the medication information and offer a pharmacist consultation. Answer D. Provide the patient with a printout of the medication information and offer a pharmacist consultation. The most appropriate action for a technician is to offer a pharmacist consultation, as patient counseling is the exclusive responsibility of the pharmacist, not the technician. The keyword most appropriate action for the technician emphasizes what a technician is legally and professionally permitted to do. A technician can provide written information and facilitate communication with the pharmacist, who is mandated to offer counseling, especially for new prescriptions, even if the patient pays cash. For example, if a patient is picking up a new blood pressure medication, the technician should always ask if they would like to speak with the pharmacist for counseling. Always remember that direct patient counseling on medication use, side effects, and adherence is the pharmacist's role. Question 2. A patient needs to take 250 mg of amoxicillin. The pharmacy only has amoxicillin 500 mg capsules. How many capsules should the patient take per dose? I. 1 capsule. B. 0.5 capsules. C. 2 capsules. D. 0.25 capsules. Answer B. 0.5 capsules. This question tests basic dosage calculation, specifically how to determine the correct number of units when the available strength is higher than the prescribed dose. To find out how many capsules are needed, you divide the desired dose, 250 mg, by the available dose per capsule, 500 mg. This calculation yields 0.5 capsules, meaning half of one 500 mg capsule is required to achieve the 250 mg dose. For instance, if a prescription calls for 10 mg of a drug and only 20 mg tablets are available, the patient would take half a tablet. Remember that sometimes the answer might involve splitting tablets, but capsules generally cannot be accurately split, which might prompt a call to the prescriber for an alternative dosage form or strength. Question 3. Which of the following drugs is a common over-the-counter OTC pain reliever that can increase the risk of bleeding, especially when taken with anticoagulants like warfarin? I. Acetaminophen, Tylenol. B. Ibuprofen, Advil, Motrin. C. Diphenhydramine, Benadryl. D. Loperamide, Imodium. Answer B. Ibuprofen, Advil, Motrin. This question assesses knowledge of common OTC medications and their potential drug interactions. Ibuprofen, a nonsteroidal anti-inflammatory drug, NSAID, is well known for its ability to inhibit platelet aggregation, which can significantly increase the risk of bleeding when combined with anticoagulants such as warfarin. Acetaminophen does not typically increase bleeding risk, while diphenhydramine is an antihistamine and loperamide is an antidiarrheal. For example, a patient taking warfarin for a blood clot should be explicitly warned against using ibuprofen for pain and advised to choose acetaminophen instead. Always advise patients to consult a healthcare provider or a pharmacist before combining OTC pain relievers with prescription medications, especially blood thinners. Question 4. According to federal law, how long must records for controlled substances, DEA forms, inventories, etc., be maintained by a pharmacy? I. 1 year. B. 2 years. C. 5 years. D. 7 years. Answer B. 2 years. This question tests knowledge of federal pharmacy law concerning controlled substances record retention. Federal law, specifically the Controlled Substances Act, requires that all records for controlled substances, including DEA forms, inventories, and prescriptions, be maintained for a minimum of 2 years. While some states may have longer retention requirements, 2 years is the baseline federal standard. For instance, a pharmacy must keep its biennial inventory records for Schedule IIV drugs for at least this duration. Always check both federal and state laws and follow the more stringent requirement when there is a difference. Question 5. A pharmacy technician is preparing a sterile compound in a laminar airflow workbench, FW. Which of the following actions is a critical step to maintain aseptic technique? I. Wiping down the work surface with sterile water before compounding. B. Wearing sterile gloves over non-sterile gloves during compounding. C. Placing all necessary supplies into the LFW before turning it on. D. Working at least 6 inches inside the LFW to prevent dirty air from contaminating products. Answer D. Working at least 6 inches inside the LFW to prevent dirty air from contaminating products. Maintaining aseptic technique during sterile compounding is crucial for patient safety, and this question highlights a key procedural detail. The critical step involves working deep enough within the laminar airflow workbench, IFW, to ensure that only filtered, first air reaches the sterile products, preventing contamination from the turbulent air near the opening. Wiping surfaces with isopropyl alcohol, not sterile water, is correct, and gloves should be sterile without needing a non-sterile underlayer unless required by specific facility protocols. Also, the LAFW should be running for a specified period, e.g., 30 minutes, before placing supplies inside. For example, when drawing up medication into a syringe, a technician must hold the syringe and vial well within the LAFW's airflow to prevent microbes from the surrounding environment from entering. Remember that the first air zone is the most critical area for preventing contamination. Question 6. A prescription reads, hydrochlorothiazide 25 mg number 30 sig. 1 tablet PO daily. Refills. 2. The patient requests a refill after 20 days. What should the technician do? I. Fill the prescription for 30 tablets as requested. B. Fill the prescription for a prorated amount, e.g., 10 tablets, to last until the 30-day mark. C. Inform the patient that the prescription is too early to refill according to the typical 30-day supply. D. Contact the prescriber for authorization to fill early. Answer C. Inform the patient that the prescription is too early to refill according to the typical 30-day supply. This question tests a technician's understanding of refill parameters and inventory management in a pharmacy setting. Given that hydrochlorothiazide is a maintenance medication, a refill request after only 20 days for a 30-day supply is typically too early without specific justification, indicating either misuse or a potential error. The most appropriate action is to inform the patient of the usual refill schedule, as standard practice often dictates a specific window, g. 2 to 3 days prior to the exhaustion of the previous supply, for refills to prevent early access or potential diversion. For instance, if a patient usually picks up a 30-day supply of medication on the 1st of the month, requesting it on the 20th would be premature. Always adhere to refill guidelines, and if an early refill is truly needed, e.g., for vacation, consult the pharmacist, who may then contact the prescriber or insurance. Question 7. Which of the following abbreviations, if misinterpreted, could lead to a significant medication error involving frequency or quantity? I. QD. B. BID. C. U. D. TID. Answer C. U. This question focuses on dangerous abbreviations that can lead to medication errors, a critical aspect of patient safety. The abbreviation U for unit is a known dangerous abbreviation because it can easily be mistaken for a 0, the number 4, or cc cubic centimeters, leading to a tenfold or greater overdose, especially with insulin. For example, if a prescription intended 10 units of insulin but was misread as 100 units, it could be fatal. The other abbreviations QD, BID, TD relate to frequency, and while misinterpretations can occur, U has a uniquely high potential for severe harm due to its visual similarity to other characters or numbers. Always clarify any ambiguous abbreviations with the prescriber to ensure patient safety. Question 8. A new medication, xylitolax, has been approved by the FDA with a Risk Evaluation and Mitigation Strategy (REMS) program. What does a REMS program primarily aim to do? I. Ensure that the drug is only prescribed by specialists. B. Monitor the drug's long-term effectiveness in a broader patient population. C. Minimize specific serious risks associated with a drug by implementing strategies to ensure benefits outweigh risks. D. Provide financial assistance to patients who cannot afford the medication. Answer C. Minimize specific serious risks associated with a drug by implementing strategies to ensure benefits outweigh risks. This question tests understanding of risk evaluation and mitigation strategies, REMS, which are crucial for drugs with significant safety concerns. A REMS program is a strategy implemented by the FDA to manage a known or potential serious risk associated with a drug, ensuring that its benefits outweigh its risks. It may involve specific requirements like special certifications for prescribers or pharmacies, patient registries, or specific patient education. For instance, isotretinoin, an acne medication, has a REMS program due to its severe teratogenic effects, causing birth defects, requiring prescribers, pharmacies, and patients to register and confirm monthly negative pregnancy tests. Always recognize that REMS programs are designed to mitigate specific serious safety risks to patients. Question 9. What is the primary purpose of a lookalike, soundalike, lossy drug list in a pharmacy? I. To help technicians quickly find drugs on the shelf. B. To identify medications that are frequently prescribed together. C. To highlight medications that have similar names and appearances, increasing the risk of medication errors. D. To track drug inventory levels more efficiently. Answer C. To highlight medications that have similar names and appearances, increasing the risk of medication errors. This question addresses a fundamental aspect of patient safety and error prevention in pharmacy practice. The primary purpose of a lookalike, soundalike, lossy drug list is to identify and bring awareness to medications that have similar names or appearances, as these similarities significantly increase the risk of dispensing errors. By knowing which drugs are easily confused, pharmacy staff can implement additional safeguards, like separate storage or extra verification steps, to prevent mistakes. For example, celecoxib and Celexa are LASA drugs. One is an NSAID, and the other is an antidepressant, so confusing them could have serious consequences. Always use LASA lists and other error prevention strategies to enhance patient safety. Question 10. A pharmacy receives a prescription for azithromycin 250 mg number 6, sig. Take 2 tablets on day 1, then 1 tablet daily for 4 days. How many milligrams of azithromycin will the patient take in total over the entire course of therapy? I. 1,000 milligrams. B. 1,250 milligrams. C. 1,500 milligrams. D. 750 milligrams. Answer C. 1,500 milligrams. This question tests multi-step dosage calculation and understanding of medication instructions. The patient takes 2 250 milligrams tablets on day 1, which equals 500 milligrams. Then, for the next 4 days, they take 1 250 milligrams tablet daily, totaling 4 days * 250 milligrams per day equals 1,000 milligrams. Adding the day 1 dose to the subsequent doses gives a total of 500 milligrams, plus 1,000 milligrams equals 1,500 milligrams for the entire course of therapy. For example, if a patient takes 500 milligrams on day 1 and then 250 milligrams for 5 more days, their total intake would be 500 milligrams plus 5 * 250 milligrams equals 1,750 milligrams. Always break down complex SIG codes into individual steps to avoid calculation errors. Question 11. Which of the following is a Schedule II controlled substance commonly used for ADHD? I. Alprazolam, Xanax. B. Lisdexamfetamine, Vyvanse. C. Codeine, Tylenol number 3. D. Tramadol, Ultram. Answer B. Lisdexamfetamine, Vyvanse. This question tests knowledge of controlled substance scheduling and common drug uses. Lisdexamfetamine, Vyvanse, is a Schedule II controlled substance, meaning it has a high potential for abuse and dependence, and it is commonly prescribed for attention deficit/hyperactivity disorder, ADD. Alprazolam, Xanax, is a Schedule 4 benzodiazepine. Codeine and Tylenol No. 3 is a Schedule 3 opioid, and Tramadol Ultram is a Schedule 4 opioid. For instance, prescriptions for Vyvanse cannot be refilled and typically require a new written prescription each time. Understanding the DEA schedule of a drug is vital for proper handling, inventory, and prescription processing in a pharmacy. Question 12. A medication order for a pediatric patient reads: amoxicillin suspension 125 mg POTID. The pharmacy stocks amoxicillin 250 mg per 5 ml suspension. How many milliliters should the patient receive per dose? I. 1. 25 ml. B. 2. 5 ml. C. 5 milliliters. D. 10 milliliters. Answer B. 2. 5 ml. This question involves calculating the correct volume for a liquid medication based on the ordered dose and the available concentration. The desired dose is 125 milligrams, and the available concentration is 250 milligrams per 5 milliliters. To find the volume, set up a proportion: 125 mg/xml equals 250 mg/5 milliliters. Solving for x, you get x equals 125 mg*5 milliliters / 250 milligrams equals 5 ml per dose. For example, if you need to give 100 milligrams of a drug that comes as 200 milligrams per 10 milliliters, you would give 5 milliliters. Always double-check your calculations, especially with pediatric dosages, as errors can have serious consequences. Question 13. Which organization is responsible for accrediting pharmacy technician training programs and developing certification exams for technicians? I. American Society of Health System Pharmacists, ASHP. B. National Association of Boards of Pharmacy, NABP. C. Accreditation Council for Pharmacy Education, ACPE. D. Pharmacy Technician Certification Board, PTCB. Answer I. American Society of Health System Pharmacists, ASHP. This question tests knowledge of key pharmacy organizations and their roles. The American Society of Health System Pharmacists, ASHP, is the primary organization responsible for accrediting pharmacy technician training programs, ensuring they meet quality standards. While PTCB develops certification exams, ASHP focuses on program accreditation. ACPE accredits pharmacist degree programs and continuing education, and NABP primarily deals with pharmacist licensure and state board matters. For instance, when choosing a technician training program, checking if it is ASHP accredited ensures it meets recognized educational standards. Understanding the roles of these organizations helps clarify the different aspects of pharmacy regulation and education. Question 14. A pharmacy technician receives a prescription for a compounded ointment containing 2% hydrocortisone. The pharmacy has 10% hydrocortisone cream and a plain moisturizing base. To prepare 50 grams of the 2% ointment, how much of the 10% hydrocortisone cream is needed? I. 5 grams. B. 10 grams. C. 20 grams. D. 40 grams. Answer B. 10 grams. This question involves a common compounding calculation known as alligation, or using a simple desired quantity/concentration formula. You need 50 grams of a 2% ointment, so the total amount of hydrocortisone needed is 2% of 50 grams, which is 1 gram of pure hydrocortisone. Since you are starting with a 10% hydrocortisone cream, you need to determine how many grams of this cream contain 1 gram of hydrocortisone. This is calculated as 1 gram of desired active ingredient /010 concentration equals 10 grams of the 10% cream. For example, if you needed 30 grams of a 1% cream from a 5% stock, you would need 1% of 30G equals 0.3G active dash 0.3G/0.05 equals 6G of the 5% cream. Always calculate the total active ingredient needed first, then determine the quantity of the stock solution or cream required. Question 15. During the inventory management process, what does par level primarily refer to? I. The price at which a medication is sold to patients. B. The maximum amount of medication that should be stocked on the shelf. C. The predetermined quantity of an item that must be on hand at all times. D. The expiration date of a medication in stock. Answer C. The predetermined quantity of an item that must be on hand at all times. This question assesses understanding of inventory management terminology, which is critical for efficient pharmacy operations. The PAR level, periodic automatic replacement, refers to the minimum inventory level at which an item should be reordered to ensure that a sufficient quantity is always available without overstocking. This helps prevent stockouts and ensures medications are consistently available for patients. For example, if a pharmacy has a PAR level of 10 bottles for a common antibiotic, an order would be placed when the quantity on hand drops to or below 10 bottles. Understanding PAR levels helps maintain adequate stock while minimizing waste and carrying costs. Question 16. A patient presents a prescription for warfarin 5 mg POQPM number 30 refills. 0. The technician notices the patient also has a prescription for ibuprofen 600 mg TID PRN pain. What is the most critical action for the technician to take? I. Dispense both medications as prescribed. B. Alert the pharmacist about a potential drug interaction. C. Remind the patient to take the ibuprofen with food to prevent stomach upset. D. Ask the patient if they are experiencing any pain that requires ibuprofen. Answer B. Alert the pharmacist about a potential drug interaction. This question tests a technician's ability to identify potential drug interactions, a key aspect of patient safety. Warfarin is an anticoagulant, blood thinner, and ibuprofen and NSAID can significantly increase the risk of bleeding when taken concurrently with warfarin. This interaction is clinically significant and potentially dangerous. Therefore, the most critical action is to immediately alert the pharmacist, as they are responsible for assessing the interaction and determining the appropriate course of action, which might include contacting the prescriber. For instance, ignoring this interaction could lead to severe gastrointestinal bleeding for the patient. Always prioritize patient safety by recognizing and escalating potential drug interactions to the pharmacist. Question 17. Which of the following is a critical component of a closed system transfer device, CSD, used in sterile compounding, particularly for hazardous drugs? A HEPA filter to purify incoming air. B. A vented needle to equalize pressure during reconstitution. C. A mechanism that prevents the escape of hazardous drug aerosols or vapors. D. A sterile syringe for drawing up medications. Answer C. A mechanism that prevents the escape of hazardous drug aerosols or vapors. This question focuses on the specific purpose and critical features of closed system transfer devices, CSTDs, which are essential for safe handling of hazardous drugs. The primary function of a CSTD is to prevent the escape of hazardous drug aerosols or vapors into the environment and to prevent contaminants from entering the drug product, thereby protecting both the compounder and the patient. While sterile syringes and HEPA filters are involved in sterile compounding, they are not exclusive or defining components of a CSTD's core mechanism. For example, CSTDs used with chemotherapy agents have specialized connectors that mechanically prevent drug leakage during transfer. Always remember that CSTDs are a crucial safety measure to minimize exposure to hazardous medications during preparation and administration. Question 18. A patient brings in a prescription for metformin 500 mg POBID number 60 refills. 5. According to common insurance billing practices, what is the maximum number of days supply typically allowed for a maintenance medication in one fill? A. 30 days. B. 60 days. C. 90 days. D. 120 days. Answer C. 90 days. This question pertains to common insurance billing practices for maintenance medications. For long-term maintenance medications, many insurance plans and pharmacies allow for a 90-day supply to be dispensed at one time, often referred to as a long-term supply or mail-order supply. This practice is designed to improve patient adherence and reduce the frequency of pharmacy visits. While a 30-day supply is standard, 90-day fills are increasingly common for stable patients on chronic therapies. For example, a patient taking medication for high blood pressure might switch from monthly 30-day fills to a 90-day supply to reduce copays and pharmacy trips. Always be aware of insurance plan limitations and patient preferences regarding days supply. Question 19. What does the DA2 code mean when entered into a pharmacy's billing system? I. Dispense as written, patient requested generic. B. Dispense as written, prescriber requested brand medically necessary. C. Dispense as written, generic not available. D. Dispense as written, brand necessary, but generic exists and patient refused generic. Answer D. Dispense as written, brand necessary, but generic exists and patient refused generic. This question tests knowledge of dispense as written DA2 codes, which are crucial for proper insurance billing and medication dispensing. DA2 specifically indicates that the prescriber authorized generic substitution, but the patient requested the brand name product. This code communicates to the insurance company why a more expensive brand name drug was dispensed when a generic alternative was available. For example, if a patient insists on brand name Lipitor despite a generic atorvastatin being available and authorized, the technician would use DA2. Understanding DA codes is essential for accurate insurance claims and minimizing audit risks. Question 20. A pharmacist asks a technician to pull a drug that is an angiotensin-converting enzyme, ACE, inhibitor. Which of the following would be the correct choice? I. Amlodipine, Norva-C. B. Lisinopril, Prinaval, Zestrol. C. Metoprolol, Lopressor, Toprol XL. D. Valsartan, Diovan. Answer B. Lisinopril, Prinaval, Zestrol. This question tests knowledge of drug classifications, a core aspect of understanding medications. Lisinopril is an ACE inhibitor, identifiable by the pril suffix in its generic name, which is a common clue for this drug class. ACE inhibitors are primarily used to treat high blood pressure and heart failure. Amlodipine is a calcium channel blocker, metoprolol is a beta blocker, and valsartan is an angiotensin receptor blocker, ARB. For example, a patient prescribed lisinopril might be counseled on potential side effects like a dry cough, which is characteristic of ACE inhibitors. Recognizing drug classes helps in understanding a medication's action, common side effects, and potential interactions. Question 21. Which of the following is a primary function of the Drug Enforcement Administration, DEA? I. To ensure the safety and efficacy of prescription and over-the-counter drugs. B. To regulate the manufacturing, distribution, and dispensing of controlled substances. C. To accredit pharmacy schools and continuing education programs. D. To manage the Medicare Part D prescription drug benefit program. Answer B. To regulate the manufacturing, distribution, and dispensing of controlled substances. This question assesses knowledge of federal agencies and their specific roles in pharmacy. The Drug Enforcement Administration, DEA, is primarily responsible for enforcing the Controlled Substances Act, which involves regulating and overseeing all aspects of controlled substances, from manufacturing and distribution to dispensing and record-keeping, to prevent diversion and abuse. The FDA ensures drug safety and efficacy, ACP accredits pharmacy education, and CMS, Centers for Medicare and Medicaid Services, manages Medicare Part D. For example, the DEA issues registration numbers to pharmacies to legally handle controlled substances and conducts audits to ensure compliance. Knowing the DEA's role is crucial for handling controlled substances lawfully. Question 22. A patient is prescribed Synthroid 100 micrograms PO daily. The pharmacy technician should recognize that Synthroid is a common brand name for which generic medication? I. Levothyroxine. B. Atorvastatin. C. Furosemide. D. Metoprolol. Answer I. Levothyroxine. This question tests knowledge of common brand generic drug names, a critical skill for pharmacy technicians. Synthroid is a widely recognized brand name for levothyroxine, a thyroid hormone replacement medication. Atorvastatin is Lipitor, furosemide is Lasix, and metoprolol is Lopressor or Toprol XL. For example, a patient may refer to their thyroid medication as Synthroid, but the pharmacy dispenses the generic levothyroxine. Knowing these common pairings helps ensure accurate dispensing and patient communication. Question 23. A pharmacy technician is about to transfer 20 milliliters of a medication into an empty 4-bag. After drawing the medication into a syringe, what is the most appropriate next step to ensure sterility and proper technique? I. Immediately inject the medication into the 4-bag. B. Milk the air bubbles out of the syringe, then recap the needle before injection. C. Visually inspect the syringe for particulate matter, then clear air bubbles before injection. D. Wipe the injection port of the 4-bag with sterile water. Answer C. Visually inspect the syringe for particulate matter, then clear air bubbles before injection. This question highlights a crucial step in maintaining sterility and accuracy during sterile compounding. Before injecting any medication, it is essential to visually inspect the syringe for any particulate matter, undissolved drug, glass shards, and remove any air bubbles to ensure the correct dose is administered and to prevent air embolisms if directly injecting into a patient, though in this case it's for an 4-bag. Wiping the injection port with alcohol, not sterile water, is also critical, but the question asks about the syringe step after drawing. Recapping a needle is generally discouraged due to needle stick injury risk. For instance, tiny glass fragments can sometimes appear after breaking an ampoule, making inspection vital. Always prioritize visual inspection and air bubble removal to ensure patient safety and dose accuracy. Question 24. A pharmacy technician is entering a new prescription for a patient who is allergic to penicillin. The prescription is for amoxicillin. What immediate action should the technician take? I. Override the allergy alert and proceed with filling the prescription. B. Consult the pharmacist to verify the prescription against the patient's allergy profile. C. Inform the patient that they cannot receive the medication due to their allergy. D. Change the prescription to a different antibiotic without consulting the prescriber. Answer B. Consult the pharmacist to verify the prescription against the patient's allergy profile. This question addresses critical patient safety protocols related to allergies. Amoxicillin is a penicillin-class antibiotic, and if a patient has a documented penicillin allergy, dispensing it could lead to a severe reaction. Therefore, the immediate and most appropriate action for a technician is to alert the pharmacist, who is responsible for verifying the allergy and resolving the potential issue, which might involve contacting the prescriber for an alternative medication. A technician should never override an alert or change a prescription independently. For example, if the system flags a penicillin allergy for an amoxicillin order, the technician must not proceed until the pharmacist reviews the situation and advises. Always refer allergy alerts to the pharmacist for their clinical assessment and intervention. Question 25. What is the primary purpose of a Material Safety Data Sheet, MSDS, now known as a Safety Data Sheet, SDS? I. To provide billing information for hazardous medications. B. To outline the proper disposal methods for expired medications. C. To provide detailed information about a hazardous chemical, including its properties, hazards, and safety precautions. D. To list all controlled substances available in the pharmacy. Answer C. To provide detailed information about a hazardous chemical, including its properties, hazards, and safety precautions. This question tests knowledge of safety documentation in the workplace. The primary purpose of an SDS safety data sheet, formerly MSDS, is to provide comprehensive information about a hazardous chemical, including its physical and chemical properties, potential health hazards, safe handling and storage procedures, emergency control measures, and disposal considerations. This information is crucial for ensuring the safety of pharmacy staff who may handle these chemicals. For example, an SDS for isopropyl alcohol would detail its flammability and proper storage. Always consult the SDS when working with unfamiliar or hazardous chemicals to ensure safe practices. Question 26. A patient asks the pharmacy technician, Why is my blood pressure medication so much more expensive this month? The technician observes that the patient's usual generic medication was dispensed as the brand name version. What is the most likely reason for this situation? I. The patient requested the brand name without a DA code. B. The prescriber indicated dispense as written DA1 on the prescription. C. The generic medication was out of stock and the pharmacy automatically substituted the brand. D. The patient's insurance plan no longer covers the generic version. Answer B. The prescriber indicated dispense as written DA1 on the prescription. This question probes into common reasons for dispensing brand name medications when a generic is available, focusing on prescriber intent. The most likely reason a brand name medication would be dispensed and consequently more expensive is that the prescriber specifically requested it using a dispense as written DA1 code, meaning no generic substitution is permitted. While other options might occur, a prescriber's explicit instruction to dispense brand is a definitive reason. For example, some physicians might prefer a specific brand for a patient who has been stable on it, even if a generic exists. Understanding DA codes is essential for accurate dispensing, billing, and patient communication regarding medication costs. Question 27. A pharmacy is conducting its annual inventory of controlled substances. For which schedule of controlled substances must an exact count be performed? I. Schedule 5. B. Schedule 4. C. Schedule 3. D. Schedule 2. Answer D. Schedule 2. This question tests knowledge of federal regulations regarding controlled substance inventory. According to federal law, an exact physical count must be performed for all Schedule II controlled substances during inventory, whether it's the initial, biennial, or transfer inventory. For Schedule III, IV, and B substances, an estimated count is acceptable unless the container holds more than 1,000 units and is open. For example, a pharmacy must meticulously count every tablet or capsule of oxycodone or Adderall on hand. Understanding this distinction is vital for maintaining compliance with DEA regulations and preventing diversion. Question 28. Which of the following is an example of a tall man lettering drug name to help prevent medication errors? I. Celebrex/Suloxane. B. Hydrochlorothiazide/hydralazine. C. Metoprolol/metronidazole. D. Amoxicillin/ampicillin. Answer I. Celebrex/Suloxane. This question asks about tall man lettering, a specific strategy used to reduce medication errors due to look-alike, sound-alike, lossy drug names. Tall man lettering involves using uppercase letters for specific portions of drug names that are easily confused, making them visually distinct. Celebrex and Suloxane is a classic example where the differing parts of the names are capitalized to highlight their differences and prevent confusion between the NSAID, celecoxib, and the antidepressant, citalopram. The other options are examples of lossa drugs but don't demonstrate tall man lettering. Employing strategies like tall man lettering is a critical part of patient safety efforts in pharmacy. Question 29. A physician orders heparin 5,000 units SC bid. The pharmacy stocks heparin vials labeled 10,000 units/ml. How many milliliters should be administered per dose? I. 0, 25 ml. B. 0, 5 ml. C. 1 milliliter. D. 2 milliliters. Answer B. 0, 5 ml. This question requires a dosage calculation involving units and concentration. The desired dose is 5,000 units, and the available concentration is 10,000 units per milliliter. To calculate the volume needed, divide the desired dose by the concentration. 5,000 units/10,000 units/ml equals 0.5 ml. For instance, if a doctor ordered 2,500 units of heparin and the vial was 5,000 units/ml, the dose would be 0.5 ml. Always ensure accurate calculations for high-alert medications like heparin, as errors can have severe consequences. Question 30. What does the term formulary refer to in the context of pharmacy and insurance? I. A list of all medications available for purchase from a specific wholesaler. B. A comprehensive list of medications covered by a health insurance plan or hospital. C. The process of compounding custom medications for individual patients. D. The total inventory value of medications stored in a pharmacy. Answer B. A comprehensive list of medications covered by a health insurance plan or hospital. This question tests understanding of pharmacy and insurance terminology. A formulary is essentially a list of prescription drugs covered by a health insurance plan or a healthcare system, like a hospital. It categorizes drugs into tiers G, generic, preferred brand, non-preferred brandy, which dictate patient copays. The keyword formulary is critical here, differentiating it from inventory or compounding. For example, a patient's insurance might cover generic atorvastatin but place brand name Lipitor on a higher, more expensive tier, reflecting its formulary status. Understanding formularies helps technicians explain medication costs and identify potential prior authorization needs.